All right, it would seem they're getting desperate. Now, what do I mean by that? So a recent study came out sort of bashing a ketogenic diet, saying it leads to rapid onset of cardiovascular disease. And why is that being published? And first, I'll talk about that, but first I want to tell you the reason why. Well, there is a study that is going to be published very soon. It is a so-called lean mass hyper-responder study. And what it did is it looked at 100 people that had very, very high cholesterol. We're talking total cholesterol 400, 500, 600, 700, ridiculously high cholesterol. These people are all relatively older, average age of 55, so perfect cardiovascular disease range. And the baseline data gathered on these people show that despite all of the super high cholesterol, which they've had for many, many years, shows almost no cardiovascular disease or very, very little cardiovascular disease based upon high resolution CT angiography, right? Pretty much the gold standard for measuring this stuff. And so that initial data is going to be compared against something called the Miami Heart data. Now, this is being done by a guy named Dr. Matthew Budoff, who is at UCLA in conjunction with a few other researchers, primarily Dave Feldman and others. And so that information is going to be published basically in about 2 or 3 weeks, right? Now, I assume it's going to show favorable to Miami Heart data. It most likely will, and that's going to be the first step. And then they're going to continue that group, that cohort for a year, staying with very high cholesterol, and then re-imaging them again with the very high quality data, and that'll be published. That data will be finished in February, published probably several months subsequent to that. So these studies are coming out, and these are going to be potentially casting a lot of doubt on the supposed sort of complete dominance of ApoB or LDL cholesterol in being causative for heart disease. This is going to cause a problem with that widely held belief. And so they're trying to get ahead of this. And so what do? They release a case report. Now, what does this case report show? Well, it takes a person who already has severe cardiovascular disease such that, and this is the abstract of it was presented at the American Heart Association's annual meeting, right? This is what some of these people are clinging to. So this person has heart disease, already clearly has heart disease, has already had an angioplasty with a stent put in there, so-called PCI or percutaneous cardiac intervention, right? PCI. So that person goes another couple of years, is on a statin, right? So we have no idea what's going on this whole time. Maybe the statin is making it worse. There is indication that statins actually make calcification worse. So 2 years on statin, and then they decide, I'm going to go keto. And it's for an unspecified period of time. It could have been 6 months, could have been 3 months, could have been a year. We don't know how long they were on keto. We don't know anything else about the patient. We don't know if they were smoking. We don't know if they were, if they lost any weight, if they gained weight. Don't know anything about that, right? But after going on keto for an unspecified period of time, and it was not even keto, it was keto-like. This is what they call it, a keto-like diet, right? Actually, no, that's the other study. I'll go back to that. I'll show you. I've got another study to show you later today. But anyway, they go keto for an unspecified period of time, 3 months, 6 months, 2 days, who knows? And then they have progression of disease found later, subsequently. And so they're saying that keto has caused that. Now, there's absolutely no way to know if keto caused it. It's very likely that the disease has progressed, even though they were on the statins for 2 years. And it was just continuing to progress. Now, this is what they're reaching for. This is actually a study which you can make no inferences of, and they're making these inferences, and the headline is, we're hearing it, all these cardiologists, keto is causing rapid progression of cardiovascular disease, which there's no way you can infer that from that particular study. Whether it does or does not is unknown, right? And I think this lean mass hyper-responder study may show that it probably doesn't, particularly if everything else is well metabolically. Like I said, good glucose control, normal blood pressure, low triglycerides, high HDL, low levels of body fat. Again, we'll see, but the desperation is showing. I've got another study I'll show you guys later today, which is also just ridiculous. Anyway, the war on low carb, keto, carnivore diets continue. They're getting desperate, but guess what, guys? We're smarter than that. And, after getting back from this conference, I can see how deceptive these scientists can be about, designing studies that they know will show the outcome they want. Like I said, they'll use sort of, kind of, maybe they won't do it long enough. Maybe the dosage they do on particular drugs make them non-effective, and they know that ahead of time. So there are scientists that are actually intentionally deceptive, unfortunately. And this is what we're up against, guys. So keep on guard. Don't fall for the nonsense. We will talk to you soon. Keep staying strong. Stop eating the garbage. Stop giving these people your money. And let's keep the fight up, guys. Talk to you soon.